Good afternoon, my name is Janine DeLonge. I'm an AET student studying paramedicine. I've been asked to do a respiratory assessment on you today. Can you confirm your name and date of birth for me?
Kevin DeLonge, 18th of April 1968.
So this assessment is, I'm going to look at your chest. I'm also going to auscultate, which means to listen to your chest. I'm also going to palpate, which means I need to touch your chest. Are you happy for me to do this assessment on you?
Yes.
Before we start, I'm going to look around my surroundings, see if there's any obvious medications lying around this patient, which may show me whether they have asthma or COPD, whether this patient is on any home oxygen, or anything like that. It's also about the living conditions this patient is in. So first of all, I'm going to ask you to remove your clothes from the waist up, if that's okay. I'm going to position my patient at a 45-degree angle, which is the most optimal angle for respiratory assessment. Do you have any pain before we start? Or any discomfort? No. Okay, so can you count from 1 to 10 to me, please?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
This patient at the moment is talking full sentences. If this patient was only able to count to 1 and taking a breath, this may indicate the patient is status 1 and needs quick intervention. While I'm stood watching the patient, I'm checking for any accessory muscle use to see whether he's actually struggling to breathe. I'm also looking at the colour of the patient, looking for the perfusion, maybe seeing whether the patient is cyanosed. Do you have any coughs or anything at the moment?
No.
No. I'm going to ask you just to hold out your hands in front of you. Thank you. I'm looking at the hands. I'm going to do a cap refill to check central perfusion or peripheral perfusion. I'm also going to be looking at its colour to see whether the patient is cyanosed. I'm also going to check the temperature while I'm here. I'm also going to ask the patient to turn his hands over. I'm looking at the palms of his hands. See if there's any obvious sign of tarring, which may indicate the patient is a smoker. If they're a smoker and also short of breath, they may have a COPD. I'm going to just put your hands back over. If you can display your fingers for me. I'm having a look to see if there's any tremors on this patient. Tremors may be an indication that he has B2 agonist build-up, or maybe he's been using too much of his MDIs at that point. Okay, you can put one hand down, thank you. While I'm here, I'm just going to check his pulse, his radial pulse for rate, regularity, rhythm, and strength of it. Thank you. I'm also going to, you can put that hand down for a moment. I'm also going to just check his respiration rate. Average adult respiration rate is between 12 and 20 a minute. Anything below or above that may be indicating the patient has respiratory distress or respiratory failure at this point. Next test, I'm going to ask you just to hold out your hands and put your wrist back. This is a quick check to see if there's any CO2 retention on the patient. Again, CO2 retention may be indicating the patient has COPD at this point. Thank you. I'm just going to, can you pull down on your eyelid? I'm looking at the colour of the eye to see whether there's any indication of anemia on this patient. Thank you. I'm also going to, can you open your mouth for me? I'm going to check in the mouth, lift up the tongue, looking for any signs of cyanosis or hypoxia at this point. Thank you. You can close your mouth. If you can put your head to the left, I'm now going to check down the side of the neck. I'm looking at the jugular vein and see if there's any obvious signs of distension. Do you have any pain in your abdomen at the moment?
No.
Okay, I'm just going to push down on the abdomen, watching for any increase in the jugular venous pressure. Anything above 4 will give me a positive result. You can look directly towards me. I'm now going to check the position of the trachea, make sure it's correct. And while I'm here, I'm just going to check the lymph nodes to see if there's any obvious swellings, any deformities, any pain. Okay, that's all good. While I'm here, I'm just going to ask you to put your hands on your hips, put your shoulders forward. I'm checking for any signs of scars, which may be surgical scars around the lung areas. That's great, thank you. Okay, next I'm going to percuss. So I'm listening for any changes in the sound. I'm just going to come underneath your arm and on the other side. Thank you. Now I'm going to oscillate. When I put the stethoscope to your chest, you can just take a deep breath for me. Just lift up there. So the tapping on the chest, if I've had an increase on tapping, which is hyperresonance, may indicate a pneumothorax at that point. A strong, stony dull may be some fluid in the pleural sac area. The listening, I'm listening for good volume air entry, that it's equal on both sides. If it's not equal, again, maybe an indication that there is a pneumothorax. Also listening for any wheezes, whether they're unilateral, bilateral, which might be asthmatic, maybe chest infection. Also whether we have crackles, again unilaterally or bilaterally. Unilaterally maybe again a chest infection, bilaterally may be indicative of edema. I'm just going to put my hands on your chest. I'm going to ask you to take a deep breath for me. I'm watching for symmetry of the chest rise and fall. And again, any change in the symmetry may be a collapse of the lung. I'm just going to do the exactly same test on the back. If I can get you to lean forward and cross your arms for me. I'm going to percuss that. Deep breath in. This time when I listen to your chest, can you say 99 for me?
99, 99, 99, 99, 99, 99.
Yeah, I'm just going to do your chest, nice deep breath in. Again, looking for that symmetry, as you said. Thank you. Just going to repeat that 99 on the front as well. So again, when I put my stethoscope on you, if you can say 99.
99, 99, 99, 99,
99.
99, 99.
Excellent. Okay, so my findings that there is no abnormalities in the respiratory system with this patient. Good clear lung sounds, no change in volume on either side, no obvious cough, no obvious accessory muscle use. However, I will request oxygen saturation tests along with peak flow meter readings and chest x-rays to rule out any other issues that may occur. Thank you very much for your time. Any questions?